Now, some people will have constant pain who present to me with SI problems. Some people have intermittent pain, that it only hurts when they do certain activities such as prolonged standing or prolonged sitting or prolonged lying. And by the way, that is the most common symptom that I see in patients with sacroiliac joint problems. They cannot remain in any sustained position. No matter what position they get into, it will begin to hurt after they've been there for a short period of time. Another common symptom, and when I see a patient, they'll come in and I'll say, well, now show me your pain. They almost will always point to the sacroiliac joint. That's called the Fortin finger test. They just point to the sacroiliac joint. That's very common. And yes, you many times and almost always will have pain around the sacroiliac joint itself. Now, I have had several patients who have come to see me that really didn't have any sacroiliac pain, but had growing pain. Now, if you, let's say, for instance, you're in a dysfunction where you have an upslip with a posterior rotation, that's just one example. It will malalign the pubic bone, and you can have pubic or groin pain, and that is a common symptom of SI joint dysfunction. Not every patient with SI joint dysfunction has groin pain, but a high number of patients do. Some patients will complain of hip pain, and you can see if this is how the femur is sitting incorrectly in the acetabulum, and it can create hip pain. Also puts a stretch on the iliopsoas ligament, and that's what's creating the groin pain many times. So the patient will present usually with pain in the SI joint. Many times you'll have radiating buttock pain. It's very common to have radiating buttock pain with sacroiliac joint dysfunction. Many patients will have posterior leg pain to the back of the knee. And the most common cause for that is the sciatic nerve runs just under the piriformis. And if you have a sacral rotation, you're going to get a chronic stretch on the piriformis, number one. Number two, the piriformis is being facilitated by the brain to stabilize the SI joint. And so it becomes tight and will put pressure on the sciatic nerve, and you can get leg pain. And it's commonly posterior leg pain, usually just to the back of the knee, but sometimes will go further down the leg. The most common complaint, as I said, was sustained positioning will hurt. You cannot find a position of comfort. The patient will normally say, I have to constantly change my position to stay comfortable. And that is the most common complaint that I hear. Some patients complain with urinary frequency. That is more a female complaint that I hear, urinary frequency. Or pain with intercourse is another one. Most everyone will complain that they have increased symptoms with stair climbing or hill climbing. Very common complaint that I hear with sacroiliac problems.